Hey fellow students, my name is Meaghan, and my research partners include Fiby and Seamchou, and our research is titled The Effect of Passive Stretch on the Upper Trapezius in Relation to Neck Pain and Range of Motion in Healthy Young Individuals with Neck Pain. Just in case you didn't recognize our voices, we wanted to include a picture of each of us for our presentation so you can put a name to a face. Also, my group and I give permission to use our video as a Research 1 course material. The purpose of our research study is to investigate if passive stretching of the upper trapezius muscle will decrease neck pain, decrease muscle activity, and increase cervical range of motion in young healthy subjects with neck pain. Our research hypothesis is that passive stretching will decrease neck pain, decrease muscle activity, and increase cervical range of motion in healthy young college students with neck pain. And our null hypothesis states that passive stretching will not decrease neck pain, decrease muscle activity, and increase cervical range of motion in healthy young college students with neck pain. We recruited our subjects through convenient sampling. Pretty much we sent out emails to the students saying that we're doing our research study. We also asked the physical therapy students to help with our research study, and also when we were present at the school, we went around the hallways of the campus to ask people if they can participate in our study. Our research design was single group pre-test post-test design. So each subject did the same exact study as all subjects did, which means there was no randomization in our study. We collected data before and after the stretching intervention was applied, which is the pre-test post-test aspect of the design. So after begging and pleading, we were able to collect data from 35 Dominican students, which is amazing. Our inclusion criteria was Dominican college students, ages ranging from 20 to 45, who had pain or discomfort in the neck region or tightness of the upper trapezius muscles. Inclusion criteria included individuals that had previous trauma and surgeries in their neck, if they were receiving any medical treatment for neck pain, currently taking any pain medication, and if they had any pain radiating to their hand or forearm. Now here's Seamchou going to discuss about our procedure.
Our study procedure include IRB application submission on March 21, 2016, IRB approval on March 23, 2016, IRB modification submission on December 1, 2016. All subjects are required to read and sign the consent form and fill out demographic information, which includes rating their pain. Subject receive instruction on the test procedure and a brief description of the tools being used. Subject sitting in a chair while the surface electrodes of the EMG are placed on their affected upper trapezius and record resting muscle activity. CNIM guideline as follows. Erect position with their arms hanging at their sides. Electrode are placed between acromion and C7 vertebra. Reference electrode is placed at the spinal process of C7, wrist, or bicep. Subject will be asked to perform active cervical range of motion, include flexion, extension, bilateral, lateral flexion, bilateral rotation. All measurements were documented using a goniometer. Passive stretching in sitting position at painful site. Researcher will move the head of the subject away from the painful side to perform a gentle stretch of the upper trapezius through cervical range for 30 seconds. The same technique will be repeated 3 times with a 1-minute rest in between for relaxation, reassessment of cervical range of motion, resting upper trapezius muscle activity, and pain.
Hello everyone, my name is Phoebe and I'm going to talk to you today about the SWOT analysis of our research. SWOT stands for Strength, Weaknesses, Opportunities, and Threats of our study. So the strength of our study was all participants followed the same procedure and the same order. All research data was done in the same room on the same chair, and each researcher performed the same tasks for every participant. The weaknesses of this research study was a small sample size because we were not able to get or collect data information from more than 35 subjects, and we had no blinding or randomization, the results might be affected by the investigator applied pressure for passive stretch. Because earlier in the day I could be having really good strength, so I can give them more pressure for the stretch. By the end of the day, after seeing many subjects, I'm not going to be able to apply the same amount of pressure, and also depending on the pain level for each subject and how comfortable they were. And our last thing for weaknesses was instrument calibration. So for opportunities, learning about the effects of neck pain and upper trapezius stretch, we were able to learn about it and also teach the subjects how to perform the stretch on themselves at home easily without having someone else actually performing the stretch. Threats: body fat percentage affects the EMG reading, and a lot of studies agreed on that because depending on how much fat deposit in each muscle can affect the EMG reading. So people who are overweight might have more fat deposit in their muscle, therefore affecting their EMG reading. Amount of passive stretch. Some people can take 50%, other people might take 100%, depending on their pain level and how comfortable they were. Human error, goniometric measurements, and placements of electrodes. Subjects can get familiarized with the goniometer measurement settings by setting themselves up for the goniometer measurement and also by sitting in correct posture. In the end, we would like to thank Dr. Adir for all of her great help and effort, mentorship, and she's always there to help us. And we will be discussing our data results in March 2017 with you guys. Good luck on your research studies.